Beth from Wellness 360 coming to you with another one of our Yoga for Osteoporosis series. So this exercise program is great for anyone with the osteoporosis or osteopenia diagnosis. It's great for anyone that loves yoga and wants to keep and maintain their bone health. So today we're going to need a chair and a mat and a wall. Today we're going to be using the wall. So find an open area on your wall, grab a chair and a mat, and I'll see you in a few. All right, so we're going to start out by leaning against the wall. We're going to tuck our belly button in so we have a nice neutral spine against the wall. Just relax against the wall as if you're lying on the floor. And close your eyes, and we're going to take 5 nice deep breaths in and full exhales. Make those exhales audible, so with each inhale, you're breathing in nice and deep. And with each exhale, you can hear the exhale. Just setting the intention for all of that muscle tension to just relax into the wall. Great job. Now with our arms, we're going to inhale our arms overhead. And do your best to keep your arms against the wall. Now, as you can see, I am lacking a little range of motion too. So just do the best that you can, inhaling and exhaling. We're going to inhale arms up the wall. And exhale arms down the wall. Pay special attention to your low back. When you come up the wall, is your low back coming really far off the wall? If so, really engage those core muscles and keep your back in that neutral spine against the wall. A lot of times we compensate, we think we're hitting the wall, but all we're doing is moving our back along the wall or away from the wall. Great job, everybody. One more deep inhale. And exhale. Great job. So our feet are about a foot away from the wall. We're going to inhale our arms overhead. And you're going to exhale, you're going to slide down the wall. Now, as you slide, you may have to step your feet out just a little bit because I don't want your knees to trail over top of your toes. So I want you in this position where you're like you're getting ready to sit in a chair. You can wiggle your toes, but your knees are not coming forward over top of your toes. Then I want you to lean forward with your upper body. So your tailbone is pressed against the wall. And your upper body is in a nice and straight line. You're not looking straight ahead. You're not looking at the floor. You're looking at the edge or maybe the tip of your mat. And breathe. And release the arms down and slide back up. Great job here. Let's do that one more time. So, inhaling the arms overhead, taking 2 big steps forward. Exhale, slide down the wall. Make sure you can wiggle those toes. Lean the upper body forward, tailbone pressing against the wall, tummy nice and tight, your gaze at the edge of your mat, and breathe. Sitting back up nice and straight. Exhale the arms down and stand up just a little taller. So now we're going to do some pelvic tilts. So what you're going to do is you're going to inhale nice and deep. And as you exhale, pull that belly button in and pull that spine nice and tight against the wall. And then release with a nice deep inhale. And then exhale again. Tummy nice and tight against the wall. And again, inhale. Release that spine. Exhale, tummy in, spine against the wall. Do this just a couple times on your own with your inhale releasing and your exhale pulling that spine close to the wall. Make sure those shoulders stay in contact with the wall to the best of your ability. If you have really forward shoulders, this can be difficult. Tummy tight and pelvic tilt forward. Great job. Step away from the wall. Couple big shoulder rolls for me. And we're going to step wider than our mat. So I'm going to fix my mat here. Working on carpet, your mat gets all rolled up. Okay, so leaning it back against the wall again. Toes are pointing out. Knees are going to trail the second toe. We're not going to go past the second toe. We're just going to trail towards it. And we're going to slowly come down. So knees are going to go wide. Pull that belly button in so the spine is nice and straight. And we're going to go as low as you possibly can. You may have to wiggle your feet just a little. Keep that spine and those shoulders against the wall. And hold this with a couple deep breaths for me. Shoulders against the wall. This is a really deep squat. Your legs may be shaking a little. That's okay. Great job. Slowly come out. Woo! Wiggle around just a little bit. We're going to do this one more time. So nice deep inhale. Exhale, pull the belly button in, pull that low back against the wall. Release your shoulders down. Make sure they're not hiked up. And slowly come down. Again, as deep as you can go. Knees are out over the toes. See how I'm in a nice, my knees are in line with my toes, but I'm in a nice 90-degree angle there at my knee and stacked right over top of my ankle. Belly is tight, shoulders are back. See if you can relax into this pose. This is a very active pose. Your legs are probably shaking, but see if you can relax your upper body into this pose. Great job. Bring it up. Woo. Pull away from the wall here and move your feet. All right, we're going to do what's called the half moon pose. So your chair is off to the side. You're going to kind of come back against the wall just enough that it's pretty close so there's no fear of falling. We're going to take our right hand. We're going to tip our right hand to the chair. As we're tipping our right hand to our chair, our left leg is lifting up. So, right hand to the chair. The hand and wrist is right underneath the shoulder. The left leg is up as high as you can. The toes are pointing forward. We're going to take our left hand and we're going to open it up nice and big. If you feel comfortable and you want to gaze towards the ceiling, you're welcome to do that. Remember, you have the wall there for your balance. Very good. And bring that leg down. Bend the knees and come straight back up. Okay, turn your body towards your chair. We're going to pick up our chair, keeping the chair close to our body. We're going to move the chair to the other side. remember, with osteoporosis, you never want to twist when you're lifting or when you have weight. You want to step. Okay? So from here, we're going to tip down. Left hand now's on the chair. Right leg is going up nice and high. Point those toes forward. Make sure those hips are nice and stacked. Make sure that the shoulder is above the wrist. And inhale that right arm up towards the ceiling. Now you may find that your leg's down here. That's okay. Just make it as active as possible. You're doing great. One more deep breath. And down, and down, and back up. Very good. We're going to go to just our normal plank. So hands are going to go right on the chair. If you'd like to move it so it's on your mat, you can. Just use good body mechanics. I'm just going to place my hands on the chair, and I'm going to pop into my plank. Breathing in nice and deep, and exhaling. 3 nice deep breaths here. Great job. Step your feet forward with bent knees and bring it all the way up. Now we're going to sit in our chair. So no matter where you're at with your chair, just make sure that you're able to touch your wall. So you're going to take your my left leg, and you're going to cross it over. And then I'm going to take my left arm. So my left leg is crossed. My left arm is going to go to the wall. This is a very gentle rotation, and I know that I say all the time, no rotation, no rotation. It's okay if we do a very gentle rotation. So I have my hand on my knee here. I have my hand on the wall, and I'm just going to gently twist as far as my body feels comfortable. So I feel really good right about here. So I'm going to hold this for just a couple breaths. Great job. And now for the sake of the video, I'm going to stay here, but I want you to switch to your other side. So I'll give you just a moment to stand up and with good form move your chair. And then you're going to sit down. This time you're going to cross your right leg over your left. So the leg that's beside the wall crosses over. And then take that same hand and again find that spot on the wall. And take a nice couple deep breaths here. Great job. Slowly untwist here. Everybody, we're going to stand up from our chair and we're going to take our hands against the wall, take a couple steps back with our hips. And then we're going to walk your hands down the wall, hinging at the hips, not the back. So you can see that you have a nice 90-degree angle with your hips and your back. You're going to hold here for a couple nice breaths. And bend the knees and walk the hands back up. Great job. Now if you're one that's modifying and doesn't want to go to the floor, now's the perfect time to have a seat in your chair, press pause, and do your meditation. So I went and grabbed my sweater because this, anytime I get down into one of my restorative poses, I tend to get a little cold. So grab a sweater if you'd like. Maybe you want to grab a pillow or a blanket. And what we're going to do is we're going to come down to the floor. So for me to get on the floor, I'm going to use my hands against the wall, take a deep lunge back, and slowly come down to the seated position. But however works best for you, that's what I want you to do. So what we're going to do for this pose, this is a very restorative pose. It works great with bringing that venous blood flow back to your heart. It's great for people that have circulatory problems with their legs because it just brings all of that blood that's being pulled by gravity all day long back to your heart for purification, for oxygen, and it feels really, really nice. So it is a little difficult to get in. So if you are here in this position, you're going to scoot your bum as close as you can to the wall. So from here, you're going to kind of drop down to your side and again, press that bum close into the wall. Now here's where it gets tricky. Come all the way down and walk your feet with your spine so there's no major twisting here. So you're walking your feet to your wall. And once you get here, if you'd like to slide a blanket underneath of your bottom, maybe a rolled up mat. I'm not a big fan of the blocks for osteoporosis. It just seems like a lot of pressure. But if you have something soft you'd like to put under your bum right now, this would be the time. So we're just gonna get comfortable. Maybe you need to put a pillow under your head. And whenever you find that comfortable spot for you, you're going to straighten your legs and you're going to hold those legs against the wall. We're going to close our eyes and we're going to take 10 nice and deep breaths here. So I just want you to focus on just relaxing that body, relax those hamstrings, relax that head, neck, and shoulder down into the floor. And just find that peaceful place. Two more nice and deep breaths. And slowly wiggle your fingers and toes. Open your eyes. You can pull your knees down into your chest here the best that you can. Make sure there's no pressure on your low back. And in one turn with our belly tight, place our right arm out. We're going to just kind of fall to the side. Shoulders are coming, spine is coming. And then use your hands to press yourself up the best that you can away from the wall. Thank you all so much for joining me today. If you have space, you can inhale your arms. I'm just going to bring mine to center. Namaste. Thank you so much for practicing with me today, and I look forward to seeing you again next week.